Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Kindly like, subscribe and share. Have you ever wondered about the intricacies of our hand structures, especially concerning issues like a lunate bone dislocation or a scaphoid bone fracture? Well, you're in for an enlightening journey. Our hand, a remarkable example of biological engineering, is composed of numerous bones, each performing a unique role. Two such bones, the lunate and the scaphoid, are vital in maintaining the hand's functionality. The lunate bone, shaped like a crescent moon, is a part of the proximal row of wrist bones, while the scaphoid bone, resembling a boat, lies near the base of the thumb. A dislocation or fracture in either of these can significantly impact the hand's mobility and strength. In the upcoming discussion, we will embark on an in-depth exploration of lunate bone dislocations and scaphoid bone fractures. We'll delve into their causes, signs, symptoms and diagnosis, followed by a detailed look into their treatments and potential complications. You might be surprised to learn the complexity of these conditions and their consequences. First, let's delve into the causes of these conditions. Lunate bone dislocation and scaphoid bone fractures often stem from similar incidents. Traumatic injuries, such as car accidents or heavy falls, are common culprits behind these conditions. High-impact sports, which involve a lot of hand use or potential for falls, can also lead to these injuries. Boxing, football, skateboarding, these are just a few examples. Now, the position of the hand during the impact plays a crucial role in determining which bone gets injured. For instance, a fall onto an outstretched hand, or fouche, can lead to a scaphoid fracture, particularly if the wrist is bent backwards. On the other hand, a direct blow to the palm when the wrist is flexed might result in a lunate dislocation. Understanding these causes can help in preventing such injuries. Being mindful of our movements and protective of our hands can go a long way in keeping our bones safe. But how can one recognize if they have suffered a lunate dislocation or a scaphoid fracture? Well, there are several signs and symptoms to watch out for. The most common ones include a sudden and sharp pain in the wrist or hand, often accompanied by swelling. Some people may also experience a loss of strength or inability to move their wrist or hand. In addition to these physical signs, there are several diagnostic techniques that can be used to confirm the condition. A healthcare professional will likely start with a physical examination to check for tenderness and range of motion. They may also use imaging tests like X-rays, kinetic scans or MRI to get a better look at the bones and surrounding tissues. These tools can help identify any dislocations or fractures and guide the course of treatment. Remember, early detection is key to effective treatment and recovery. It's always best to seek medical attention if you suspect a bone injury. Now, what happens once these conditions are diagnosed? When a lunate bone dislocation or scaphoid bone fracture is diagnosed, the treatment plan will largely depend on the severity of the condition. In less severe cases, immobilization with a cast may suffice. This method allows the bone to naturally heal over time. However, in more severe cases, surgical intervention may be necessary. This could involve realigning the bones and securing them with pins, screws, or plates. In some instances, a bone graft may be required to aid in the healing process. Now, let's talk about complications. If left untreated, these conditions can lead to a myriad of issues. Chronic pain is a common complication, making everyday tasks difficult and reducing overall hand function. One serious complication is the development of osteoarthritis, a degenerative joint disease that can lead to further pain and stiffness. This occurs when the smooth cartilage that cushions the ends of bones deteriorates, causing the bones to rub together. In severe cases, untreated lunate dislocation or scaphoid fracture can lead to a condition known as avascular necrosis. This is when the bone tissue dies due to a lack of blood supply, potentially leading to the collapse of the bone. Proper treatment is crucial to restore hand function and prevent long-term complications. Remember, early detection and treatment can greatly improve the prognosis for these conditions. So, what have we learned about lunate bone dislocation and scaphoid bone fractures? We've delved into their causes, like high-impact trauma and falls. We've examined the signs and symptoms, emphasizing pain and swelling, and the crucial role of imaging in diagnosis. We've also explored various treatment methods, from casting to surgery and potential complications, such as non-union and avascular necrosis. The hand is a complex structure, and understanding these conditions helps us appreciate its functionality and the importance of its care. UMCC, your ultimate medical consultant connector.